Today, I want to continue talking about intermittent fasting. So if you're someone who's been thinking about using this powerful tool, then this video is for you. We're going to talk about different types of fast, and I'm going to give you some tips to get you started. If this is the first time you're meeting, my name is Michelle. I'm a nurse, health coach, and a personal trainer, and I help type 2 diabetic patients reverse their type 2 diabetes naturally, get off medication safely, and the best part, be free from all the complications related to type 2 diabetes. Now let's get started. Now in my last video, I talked about all the benefits of intermittent fasting. I put a link to the last video in the description. It's a short video, so make sure you check it out. Now keep in mind that fasting is not a new thing. Many religions around the world have been practicing fasting for centuries. But for therapeutic reason, I like to divide fasting into 4 different categories. Number 1, time-restricted fasting. This is less than 24-hour fast, and we're going to talk about different type of time-restricted fasting in a little bit. And number 2, short-term fasting. This type of fast is usually between 24 hours to 36 hours of fast. Alternative day fasting, where you fast one day and you eat the next day. And lastly, long-term fast. And this fast normally is greater than 36 hours of fast. But in this video, I want to focus on 2 different fasts, time-restricted fasting and alternative day fasting. So let's talk about time-restricted fasting. There are different types of fasts in this category. For example, the most popular one is the 16-8 fast. I'm sure you heard of, where you count the hours between your last meal and the next meal that you're having. For example, if you finish your dinner at 8 p.m. on a Monday night, you do not eat anything until the next day at 12 noon on Tuesday. So that will make 16 hours between your dinner and your breakfast the next day that you're not eating anything, and you're letting your body to rest, you're letting your pancreas rest, and you're lowering your insulin level and improving your insulin sensitivity. Now there's another type of fast that's very popular, and it's called OMAD. This just means you only have 1 meal a day. You can choose your breakfast, lunch, or dinner, and the next day you're only having 1 meal, and then you're not having anything until the next day. So this is for the time-restricted fasting. But if you're somebody who's just getting started, even not snacking between your meals is a good start as a practice. You are practicing intermittent fasting as well. So if you're somebody who's used to eating 6 times a day, what we can do is just focus on taking 1 snack out at a time, and this will be a good start for you to practice your intermittent fasting, and you build up as you go because you want to make sure you give your body some time to adjust. Now, another type of fast that I mentioned is alternative day fasting. Now, when my mom came here to visit me, and I found out her sugar was so high, she was only taking 1 medication at a time, metformin. I put her on an alternative day fast. So for 2 months, we did 3 24-hour fasts. Her fasting schedule was on Monday, Wednesday, Friday for 24 hours. Now, we talked to her doctor, and she did not take her medication during the time she was fasting. But I didn't just put her on a 24-hour fast right away. Her morning number were between 200 to 300 when she came to visit me here. So what I did was I started focusing on 1 meal at a time and changed the meal. So for a few days, I focused on her breakfast. So I made her breakfast very nutritious, full of protein, full of healthy fat. So her breakfast looked like egg with avocado, walnuts. Sometimes she would have omelet with spinach, side of avocado. I would cook her meal with really high quality butter, and she didn't snack between her breakfast and her lunch. After a few days, we focused on her lunch. And then I changed her lunch to, again, like healthy protein, lots of veggies, healthy fat. We did that for a few days. So now she's eating a low-carb breakfast, low-carb lunch, but she could eat whatever she wanted for her dinner. After a few days, once her body adjusted to those, then we focused on her dinner. So this process for us took 2 weeks, where I had her fully move to having a low-carb breakfast, lunch, and dinner with no snack in between. And then after that, we started practicing intermittent fasting, where I slowly increased the time between her last meal and her next day breakfast. We did that for a few weeks, and then once her body adjusted to that, then we practiced having one 24-hour fast. And then when she was comfortable doing that, without being hungry, without having any low energy symptoms, then I moved her to 2, and then we eventually got to 3 24-hour fasts. The process, once we got to that stage, was about a month, because I really wanted to work slow with her. And then we did 3 times a week, 24-hour fast for 2 months. Her numbers from 2 to, as I mentioned in the morning, were 200 to 300 in the morning. By the end of the 2 months, it was around 90s, her morning numbers. And she did not need to take the metformin. We continue fasting, but instead of 3 times a week, we moved to 2 times a week. And after a month of doing that, we only did 24-hour fast only once a week. Now, her A1C was around 9.8, 9.9 when she started. And when we checked her blood sugar at the end of the 3 months, her A1C was 5.1. And she has not been taking any medication ever since. And this was about 9 years ago. And because of her, I've been able to help so many people do the same. But it depends what kind of fasting schedule I pick for a client. It depends how many medication they're taking, how their eating habit was, how many snacks. I really like to work with my clients slowly. That's why it's recommended, if you're taking a lot of medication, it's good to work with someone who already has experience, and you need to let your doctor know, because they need to adjust your medication during your fasting hours. But if you're somebody new who is, your goal is to get off your medication, or maybe you're not even taking any medication, you're just pre-diabetes and you want to get your number under control, just getting started with changing your nutrition, number one. Also, stop snacking between meals. That's a great way of practicing intermittent fasting. Once you're comfortable with that, then you can play around with skipping your breakfast or your dinner, and just increase the hours of fasting between your meals. But one tip I want to share with you is that always try to fit fasting into your lifestyle and not the way around. For example, if you are someone who has your family time every night, you like to eat dinner with your family, then skipping dinner is not a good idea, because you're missing that family time. And this may not make you very, very happy person after a while, because you're just missing that special moment with your family. So maybe for you, the better idea would be skipping breakfast. Also, a very important tip I like to share with you, to make sure you're eating enough protein during the time you're not fasting, during your eating window. Make sure you're eating enough protein. Also, your weight training, because we want to save those muscles. As we age, we lose muscle mass. It's really important for you to pick up those weights. Start a weight training program, and not only is going to help your blood sugar, but it will help you to reverse your type 2 diabetes faster as well. And make sure you're keeping yourself hydrated. Upgrade your water by adding lemon and a little bit of salt. Also, make sure if you're starting, not to jump into like a 2-day fast, and slowly build your fasting window, so you give your time for your body to adjust properly. And the last tip, make sure you're having fun. You have been given this powerful tool, which is free, to heal your body. So enjoy the journey, and let me know if you have any questions. Reach out to me if you're not sure which fasting window is the right one for you to get started. Let me know, and I'll help you figure out what your first step is. And don't forget to head on to my website, take the quiz. It's only 10 short questions, and I give you a personalized health report. There's a lot of good information there that I hope is useful and helpful to you. See you next week.